Hi, my name is Dr. Chris Christensen from Lexington, Kentucky, and I've worked here for 23 years and have a busy joint replacement practice. If you perform joint replacements or manage supply costs at a surgery center or hospital, let me ask you a simple question. Do you know what you're spending per case on surgical togas or hoods? A few years ago, while operating at a surgery center where I'm part owner, I learned that our surgical togas were going up in price. When I looked at the numbers, we were about to start paying $60 per toga, or that's $240 per case since I use 4 togas per surgery. Today, many centers are paying close to $85 per toga or $340 per case. What surprised me most was that nothing had really improved. I mean, some subtle changes, but really no better safety, no better performance, just higher cost. So, of course, I did what any surgeon would do. I started complaining, and that did no good. I tried a couple other brands, and they just didn't work out. I didn't like how they worked. So I decided to do something about it and build a better option. And that's how StubMed got started. Our togas are AAMI level 4, and our hoods are level 2. They deliver the same protection that surgeons expect without the inflated cost. Today, they're used in over 35 hospitals and surgery centers, with more than 50,000 units used annually in the United States. Our togas are $35 each. If you use 4 per case, that's $140 per case. Compared to $340, that's a $200 savings per case. So if your hospital or surgery center does 2,000 joint replacements per year, that's a saving of about $400,000 annually without lowering protection standards and without changing any of the workflow in the operating room. Now, I know what many surgeons are thinking. Lower cost usually means lower quality. That's a fair concern, but these products are used in state-of-the-art operating rooms, including my own surgery center, where thousands of cases have been performed using StubMed togas and hoods with an infection rate of less than 0.2%. Yeah, 0.2%. This isn't about cutting corners. It's about eliminating unnecessary cost inflation while maintaining the same protection standards that surgeons expect. StubMed also keeps things simple. There are no contracts, no bundles, no minimum orders. We routinely set up trials so surgeons and OR teams can evaluate the product directly in their own operating room. And if it doesn't meet your standards, there's a money-back guarantee. I built this as a practicing surgeon after performing more than 25,000 hip and knee replacements because I understood the clinical responsibility that comes with every patient and the economic pressure that comes with every case. Healthcare costs are not going down. Supply contracts are not getting simpler, but there are areas where we can make rational decisions to improve the economic side of medicine without increasing risk. StubMed sterile back togas are one of those decisions. If you'd like to evaluate StubMed in your own facility, just request a trial and we'll help you get started. You can test the product, use it in your own OR with your own team, and see how you like it. There's no pressure, there's no long-term commitment, just a straightforward opportunity to reduce cost while maintaining the standards that you expect in the operating room. Just click below to get started or go to our website, StubMed.com, StubMed.com. Thanks for your time.